Okay, so here's my summary on managing dysarthrias. There are two kinds of approaches, one being speaker-oriented and the other being communication-oriented. Speaker-oriented treatments focus on the restoring or compensating for impaired respiration, phonation, resonance, articulation, rate, and prosody, whereas communication-oriented treatments are strategies adapted by speakers and listeners to improve the comprehensibility and transmission of communication. So both very important methods and strategies, and very different in what they are effective for. So for first off, talking about respiration, if a patient doesn't need any help in this area, they will have adequate loudness and demonstrate flexible and appropriate breath patterns. So if that is the case, then this is not something that's required. But if it is the case, some things you can do are practicing exhaling at a steady rate, pushing, pulling, and bearing down. And then you can, as the clinician, or the assistant, use the phrase, take a deep breath and let it out slowly when you're speaking. Behavioral compensation and control, like I just had talked about, saying take a deep breath and let it out slowly when speaking. And then this also talks about optimal breath groups, which is the number of syllables that can be produced comfortably on one breath. So some things you could do for that are marking paragraphs for breath groups, and then trying that in scripted conversation. Prosthetic management, things like portable voice amplifiers, apps that can help with that, providing the feedback. And the behavioral compensation and the phonation both focus more on working with the rate and prosody of speech. Phonation, this talked about the benefit of teaching patients to start phonation at the beginning of an exhalation. Patients with hyperadduction can benefit from a breathy onset, a resonance. One test that was talked about was occluding a patient's nose and having them talk, if they have, if that would be something that would be beneficial for them. This can also reduce loudness and intraoral pressure. Let's see, articulation, speed training is something that was talked about. It can be a good goal for patients with a slower rate. And then that should be strengthening exercises should only be done if weakness is present and if it is related to the speech impairment. Let's see. Articulation, stretching can reduce spasticity. Traditional approaches could be hands-on or picture cues. And then in working with articulation, most patients work best when they're working on phrases. Some would benefit for practicing using the word in isolation. Let's see. Also minimal contrast, explaining to the patient that you are working on getting the distinction between the minimal pairs accurate. Rate. The book talked about this being the most powerful behavioral behaviorally modifiable variable for improving intelligibility. So the rate, and I know in the PowerPoint it talked about the pauses between words and how if you take those pauses, it can considerably slow down the rate to improve intelligibility. And practicing at what point you would take that pause, at what you would look for. Your articulators can be moving the same amount, but taking those pauses for speech. If you don't take those pauses, then you are talking faster. So really reiterating that fact. Let's see, prosthetic management. Matthew talked about the cribbage board, using one word per peg when you move that. Prosody and naturalness. This can be done with a random word list and have the patient read words off that list and you decipher what they're trying to say. Also chunking utterances down. Having them work on their intonation, saying a statement, then re-saying that same thing in a question format, and they can change the meaning of those words just by using different intonation. So I think that was pretty cool for that. And then communication-oriented treatments. These are very important. This can be something done in the patient's environment, greetings on whiteboards, alphabetical supplementation, a topic board, saying back to the patient, so this is what I understand you to have said, or this is what I hear you're saying, and just using overall good listening skills, eye contact, working hard at comprehending what they're saying, being attentive to them, also their environment, making sure that their environment is conducive to their communication, what they need, shutting off the TV, closing the door, minimizing noise, background noise especially, and then also having them sit closer to you so you can see their mouth was another thing that was good. And then communicating with the family on what you feel would benefit the patient. So if they take medicine and that improves their intelligibility for a certain amount of time after they've had their dosage, if they have a doctor's appointment to go to, or if they have an important meeting with somebody, to schedule it kind of soon after they've taken their medication. And then also within the communication-oriented treatment, getting a system in place for checking on feedback, and then also working with the patient on strategies to repair conversation breakdown. So gestures, again, the topic boards. So that is my summary.